we want to make sure that whatever policies are put in place in this country to protect the American public do not serve as a disincentive to doctors and nurses from this country volunteering to travel to West Africa to treat Ebola patients. The first is that is a it reflects a commitment from a doctor or nurse to travel to West Africa, reflects a generosity of spirit and a concern for common humanity that is worthy of praise. It also reflects a commitment to the ideal that stopping the Ebola outbreak in West Africa is the only way we can entirely eliminate the risk to the American people from the Ebola virus. What you will, and I guess this is the last thing I want to say about this, Jim, was you will hear from the CDC later today some additional information about guidelines that they believe should be in place to, as it relates to protocols for returning healthcare workers or healthcare workers who are returning from West Africa. So we'll have additional guidelines from CDC. They'll make that announcement later on this afternoon. But ultimately, it's the responsibility, in fact, the authority is vested with state and local officials to make decisions about how best to protect their citizens.
Is that possible, or is that off the table?
Well, what the President has indicated will guide him in all. What we believe is important, and I think this is a view that is shared by governors and local officials across the country, is that these kinds of policies should be driven by science and the best scientific advice that is available. We have experts at the Centers for Disease Control and at HHS that have been dealing with Ebola outbreaks for decades now. And there is a body of medical science and research that should guide the implementation of these policies. And we're going to work closely with states and localities to do exactly that. I think the best and most recent piece of evidence that I can point to illustrate this ongoing coordination is this morning's announcement that Kaci Hickox, the nurse who's recently returned from West Africa, will be discharged from the hospital in New Jersey and will be traveling via private transportation to her home in Maine.
Been actively campaigning in these midterm elections, are you?
I think any examination of the President's schedule over the course of the next 8 days in advance of the